I'm Dr. Bill Adams, and you're watching the Plastic Surgery Channel. And welcome to PSC Hot Bites, our newest program where the channel's experts cut to the chase, providing real answers to questions you want to know on hot plastic surgery procedures, topics, or technology. Joining me today via webcam is Dr. Bryan Forley from New York City. So Bryan, let's talk a little bit about Sculptra. I know you have a lot of experience with that. What is Sculptra, and what is the recent clinical uses for that product?
Well, Sculptra is a bit of a different concept in terms of injectables that we use in the face. It actually stimulates the skin to produce collagen. The activating agent in it is something called PLLA, or poly-L-lactic acid. And once it's injected, it causes the cells or fibroblasts that produce collagen to activate, and over a period of 3 months or so will actually cause a thickening of the skin. And the reason for doing this is because with changes in the face with aging, there are shifts in the volume, meaning deepening of the folds, the jowls, flattening of the cheeks. And so this enables us to restore some of the shifting changes and also add volume where there's a deficiency. And the nice thing about it is it's very gradual, very natural, it's very safe because it's gradually inducing your own collagen to be deposited, and it's very long lasting. It can last up to 3 years that I've seen in my own clinical practice, and I've had over 5 years of experience using it, and so I've been very happy with its effect on minimally invasive, one of the minimally invasive techniques for reversing some of the signs of aging.
What body areas are you typically putting Sculptra into?
Typically we're using it primarily in the face. It's used for adding volume to the cheek, where oftentimes there's a flattening as the cheek fat pad shifts down towards the lower part of the face, causing a deepening of the nasolabial fold. It's also used in the area of the fold to smooth the transition from the cheek to the lip where that fold deepens. It can also be used along the jawline in a way that it can camouflage the jowl by injecting and thickening the tissues in front of the jowl, as well as along the angle of the jawline to create a more defined, sharp jawline. And so it can really have a very, very nice rejuvenating effect on the face. And the important point also is that it's not an immediate effect. Some of the injectable hyaluronic acid fillers, for example, will give you an immediate improvement in the areas that are treated. With Sculptra, it's a very gradual change, very natural kind of progression that, as I mentioned earlier, occurs over 3 months with a 3-month time frame in mind, and occasionally, depending on each individual patient, a series of treatments, anywhere from 2 to 3 sessions, sometimes more, depending on the needs. We can achieve the nice effect that we desire.
That's really very valuable information. Well, Bryan, thank you so much for taking time out of your busy day to spend with us on Hot Bites.
Sure, my pleasure.